you may start.
Treatment of lung diseases, or to supplement lung diseases. Okay. Next one. Okay. I mean, like in business, I always like to talk about something that can attract you, oxygen. I mean, imagine now when you wrap your head with a plastic bag. Within a minute or so, you will be short of breath and you can die. Right? I mean, also if you go underwater without any breathing apparatus, you will also die. Okay, oxygen is such an important aspect of our life. And in our lungs, this is the central part of the extraction for our body's need, right? And lung diseases, however, is a major health problem worldwide. And it's also among the top causes of death. Okay, Lingzi has traditionally been used over the centuries to treat lung diseases. But of course, as a TCM treatment, there's no scientific proof. People are a bit worried. But now, there are more and more scientific proof being made. So naturally, it is being a non-toxic herbs, the interest is there. Okay, next one. Okay, as a simple introduction, in case people who do not know, the lung is our major respiratory system. Okay, when we breathe, the diaphragm, which is down below, is the one that pull down to get our oxygen to come in, to get the air to come in. The air will go through the trachea into the bronchi and into the alveoli where it is extracted, right? Where oxygen is extracted and carbon dioxide is expelled. Okay, the alveoli, if you want to take it away, it's just like a tree branches turn the other way around. The alveoli is the leaves, the bronchi is the branches, the trachea is the trunk. So that is a simple introduction of the lung. And once the oxygenated blood are exchanged, they will be brought through the heart, where then the heart will then transfer to every part of our organ to let us function and live as usual. Okay, next one. Okay, what are the common lung diseases that we come across? COPD, chronic bronchitis, chronic obstructive pulmonary disease, lung fibrosis, or another term is pulmonary fibrosis. Pneumonia, very commonly heard, TB, tuberculosis, asthma, and of course, lung cancer. All these causes are different, okay? But whatever it is, it severely affects our lung. Imagine you cannot breathe properly. These are all problems to us. So in this report, in this study here, they feature 3 reports, all right, as an auxiliary treatment to some of the diseases. Okay, we will look at these 3 reports. But before we look at these 3 reports, let us just have some simple understanding about the 3 lung diseases that the report cover. Okay, next one. First, look at pneumonia. Pneumonia, as you are all aware, is just simply an infection of the lungs. And when you have infection in the lungs, fluid and phlegm will build up in the lung. Okay, it make you hard to breathe. So you cough, you have fever. Infection, right? Infection is naturally you have fever, you have chest pain, you have breathing difficulty. It caused mainly by bacteria. Okay, sometimes virus or fungi that goes into the lung that irritates the bronchi and then cause all this infection. Okay, I mean, commonly it affects the old people. My dad passed away of pneumonia, you know. But also it affects people with chronic illnesses or weakened immunity, right? But don't think that it's just happen to the senior citizen. Sometimes young citizen also happen. Young people also get it. Just that maybe they can recover faster. Okay, but children below the age of 5 are also quite susceptible to pneumonia, and they are among the top killer among children below 5 in globally. Oh, okay, next one. TB, in short, tuberculosis. I mean, tuberculosis and infectious disease are, I mean, once you have somebody have a TB, the whole house people probably have to go for a BCG jab, and then the person who get infected have to be quarantined somewhere. Okay, I remember in the 60s, one of my distant relative where I was living with had TB, and they sent to this what we call it Middleton Hospital. So the rest, everybody in the household all had to go for their BCG jab and go for a checkup. Now this is a case infectious disease. Of course, it's infected by this bacteria called mycobacterium tuberculosis. This bacteria likes to live in an oxygen-rich environment. So when it likes to lives in an oxygen-rich environment, naturally, lung is the place where it is. Okay. It also can affect other organs, kidney, all that. But it's not common. Mainly, it affects the lung. Okay. And of course, common symptoms of typical lung diseases are cough. TB, however, also you have blood coughing out blood, you know. Sometimes on TV you see cough into the tissue and blood, you know. So why this one they cough blood? Because there's tissue damages in the lung. Chest pain, fever, fatigue, weight loss. COPD is one of them with weight loss also. These are typical people with lung infection, or very skinny one. Then you have people, although they may have infection, but they do not show any symptom. It's not active. This is called latent tuberculosis. All right, because these people, the immune is still okay, so the virus just stay inside their lung, and it will not flare out. But once his immune system become weakened, it will become active. And if he never pay attention to it over the years, it will cause damages to the lung. Okay, I have my wife has a colleague who has just because I think beginning of the year was supposed to go for some operating room. Then they have to go for all this infectious disease checkup. Then found out that he has latent TB, or else he is fit and healthy, very strong muscular person. Okay, so latent TB is actually a problem. Okay, right. Then another next, pulmonary fibrosis, another common lung disease. or lung fibrosis, just now like I mentioned now. Okay, this one is a condition where your lungs are scarred, right? There's a scar in the lung due to an infection like SARS, maybe also COVID-19 now, or then also people with lung or breast cancer, they undergo radiotherapy, chemotherapy, or target drug therapy. Because of the drug, they also can get scarring in the lungs that cause fibrosis. Then medication for arrhythmia, irregular heartbeat, steroid for immunosuppression, people with lupus all that, where they need to take lupus steroid one, they also can cause fibrosis. Some antibiotics. Okay, then another potential cause of the pulmonary fibrosis are people who live in a moldy environment, bacteria contaminated. I mean, like if your house is always closed up, not airy, the danger is there. Right? You see, why is it that in the 50s and 60s in Singapore, Malaysia, Indonesia, all that, TB was common, or even then in Asia it was common, because housing environment were all very cramped and very so-called, there's a lack of ventilation, and that caused moldiness and possible bacteria contaminated. Then another possible cause of pulmonary fibrosis are people who work in the chemical industry, like petrochemical, where all the gases, or even some gas company, all the gases, and the gas they give out, they breathe, and over time, it affects the alveoli of the lungs. Okay, or dusty environment like mining, sand quarrying, all those ceramics, polishing, carving, all that. You know, last year was it? This is 2020, 2019. Just before this, I last went to China. You know, then I took a TT. TT is our like a Grab to Zhangjiajie. The driver was telling me the father has COPD. You know, so this one is definitely a cause of fibrosis because the father works in a coal mining industry. Okay, so people in mining one is also a potential danger. All right. Okay, next one here. Okay, what happened in a pulmonary fibrosis case, lung fibrosis, is that the tissues are scarred, right? When your tissues are scarred, what happened? That means your alveoli become thickened, become stiff, so it cannot exchange air easily. You want to imagine what a fibrosis is? It's just like people with keloid, you know, on the skin, especially those who go for BCG, baby inoculation, then or people with operation, after the wound heal, right, they form a lump of growth, keloid. Fibrosis is something like that. So it's become a thickened skin, you know. So as a result, there's no free exchange of the gas. So naturally, the patient will be breathless. And then a little bit of exertion, he become breathless. I remember my mother, you know, in her final days, my mother had breast cancer. In her final days, she can't even walk a few steps. She walk a few steps only, she get very breathless, cannot breathe, right? So this is a case lah. Right, so symptoms of people with lung fibrosis are things like dry cough, chest pain, weight loss. Typical lah. Fibrosis is just the same as those opium addict, smoker or become very skinny. General weakness, fatigue, nail clubbing. You know, nail clubbing is you have a big nail and then become round, big nail like that. That's called nail clubbing. Okay. Okay. Now we go to the report in proper. Okay. The first report is talking about Lingzi can inhibit several kinds of pathogens, bacteria, including this Klebsiella pneumonia. Okay. Let's look at it. Okay, researcher, next one. Researcher from, next one, researcher from this India found out that Lingzi can inhibit several kinds of pathogens, bacteria, among them this Klebsiella pneumonia, a bacteria that cause pneumonia. Okay. Now, this finding is important because this Klebsiella pneumonia is rather difficult to treat and few antibiotics are effective. Okay, so their paper titled Evaluation Antimicrobial Antioxidant Activity of Ganoderma, all that, you can read up in yourself. It was published in the International Journal of Pharmacy and Pharmaceutical Science in 2012. Okay. All right, we look at the study in proper. Okay. The study, of course, they use the food bodies of Lingzi and then grind into powder. Dry up lah, understood lah, dry up, grind into powder and extract it with 5 types of solvent. These 5 types of solvent, maybe it gives different degree of extraction now. Okay, so they don't do the extraction like what we do in Shuangho lah. This is India. Right. So the study actually is what you call the in vitro study lah. Is they carry out through the well system. So it's like a dish, you know. You see, like in paper, in those movies, they do it in a dish. Then they put they coat the dish with the bacteria, right? They have an agar on the agar, you know. Agar is a good medium to cultivate all this. They have the agar in the dish, then they coat the bacteria in the dish. Okay. At the center of the dish, they will dip 0.5 milligram per microliter and 1 milligram per microliter of the extracted Lingzi. Right? Then they look at it after one whole day. Right? And after one whole day, they measure the zone of inhibition. Okay, before we go on to talk about the zone of inhibition, let's just look at what are the bacterial strain being tested. Next one. Right, the strain of bacteria tested are things like Bacillus subtilis. This is not harmful bacteria, it's found in the gut and it's commonly used in probiotics. You know, in probiotics, you always come across this. Enterococcus facialis that cause UTIs. This is also one of those in our intestines where you will find it. And Listeria, monocytogenes, they can cause spontaneous abortion. These are all in a sense that if you are not aware, suddenly like you pregnant, and then 3 months or 4 months later, you lose a baby, right? So you do not know what's the cause, but probably this bacteria is present. Streptococcus mutant, this one cause a tooth decay. Of course, there are other causes lah. I just list one other item lah. Klebsiella pneumonia cause pneumonia, and Proteus vulgaris also cause UTIs, wound infections, right? Very common, you see in the hospital also this type of infection that you get if you after operation in the hospital, you get wound infection. This is one of the viruses that cause it. Okay, Salmonella typhimurium, gastroenteritis and enteritis thing that can cause upset stomach, cause diarrhea, gastric flu, all that kind of thing. Okay, then you have pseudomonas. All those are then cause blood infections and lung infections. Okay, just as a guide, bacteria is different from virus. Bacteria can reproduce themselves. Okay, they go into your body, they just reproduce themselves. Okay, whereas virus, they go into the body, they cannot reproduce themselves. They need to hook on to one genes. So free radical is always unstable genes that this virus hook on to multiply. Whereas bacteria no need. They can multiply straight away. They go into your body, they multiply. Okay? Right. Okay, now I'm going to next slide. Okay, we look at we come back to the zone of inhibition that we talk about. Right. Zone of inhibition is as it is when you drop one drop in the center, okay, in the center of the dish, after 24 hours, you look at how far the virus has retreated from the center. Okay, you measure the diameter. Okay, this is showing that this bacteria has retreated, has been inhibited by the agent. Here in this case is extracted lincer lah. Okay, so they find out of all the 5 solvents, only 2 are effective: methanol and water extract. Right? Methanol extract show a strong antimicrobial activity against Proteus vulgaris and Enterococcus. Okay, moderate Salmonella, and the effect for Klebsiella pneumonia is a little bit lower, but it still can inhibit. Okay, right? Water extract also have the same level of inhibitory action against all these tested strain, except this Listeria monocyte, where you probably need a higher dosage. Okay, just we look at the table lah. Okay, the table of the methanol extract. You can see, right, from the center. Okay, take for example the Klebsiella pneumonia at 0.5 milligram per 100 microliter. The center of inhibition was 8.2, right? When its dosage is higher, it's 9. That means, of course, in theory, if you put down all the bacteria disappear, from the dish is 100% now, but the inhibition rate is not measured in this way now. The inhibition rate just measured in terms of what is the diameter. Okay, if it has exceeded a certain level, they are considered inhibitory. That's the case. That's why in here they already all show signs of inhibition. Of course, if you drop the 0.5, the agent, and there's still the virus still lives in the center, that means there's no inhibition. Okay, it's just like sometimes, you know, to use a simple analogy, it's just like you drop a drop of oil in the water. The oil spread, right? It shows how much the oil can spread, right? So the same thing as you drop a drop of the agent in the center, how much the bacteria retreat. So the more they retreat, the more effective is the inhibition. Okay, understand? Okay, next one is on water. You can see the water one is more or less the same inhibition rate. So you can see that actually the water extract, the inhibition rate for the capsular pneumonia is more effective. 15, higher. All right. So on the whole, the inhibition rate is acceptable. Right. This goes to show that Liang has capability to inhibit all these bacteria. So what they do is okay, the next thing that the study do is that they go into, now that it has can inhibit the bacteria, they want to know how much is effective. That's why they go into the research on minimum inhibitory concentration. So since only 2 of the extracts are active, they only do water and methanol. Okay, the purpose, like I said just now, is that they have to check the dosage needed, right? So, you know, sometimes you go to a clinic and the doctor may have a certain table, they look at it, how much dosage to give you. Should you take 1 teaspoon each morning or 2 teaspoons each morning, something like that. This is dosage, okay? Right, so they found that the dosage generally is about 31.2 microgram per milliliter for both methanol and water extract, except this streptococcus where the dosage has to be higher. So sometimes we always talk in Liang here, dosage sometimes higher helps. Okay, right. Next one is the table on the minimum dosage. You can see all the virus, the dosage is sufficient, whether it's water or methanol. 31.25 microgram is enough to inhibit. When you inhibit the bacteria, that means what you are doing is just stopping the bacteria from multiplying. Okay, that's the case. Stopping the bacteria from multiplying. So then after that, depending on your body immune system to tackle the bacteria. Okay, right. Okay, right. So that was the first report to show that Liang can help to inhibit bacterial growth. Okay, next one is talking about latent TB. Sorry, my dog is a little bit noisy here. Okay, Liang can also help in latent TB infection. Okay, right. Okay, what is latent TB? in short LTB, latent tuberculosis. It's a situation where one is infected with the bacteria, but yet to fall sick. Like I told you just now about my wife's colleague. He's a fit and healthy, strong man, very muscular. Go jogging, carry weight, all that. But they didn't know that he has latent TB until he went for a complete blood test and X-ray test. Okay. Now, of course, as it is, we are young. Immune is strong. Fine, it won't happen. But when your immune is weak, you will become active, right? And when it becomes active, medication will be very complicated. And the fertility rate of people after some period of time can run as high as 35%. Okay, so it's no play, no joke, can kill, All right, I mean, it's still higher than COVID-19 now. COVID-19 is below 3% only. Right, so naturally, if you check and got latent TB, you treat it during the latent stage, it's easier and shorter, lesser medication, lesser damages. So the key is prevention and treatment when it is still in the latent stage. Then to wait for it to flare up. Okay, right. Okay, this the study. Next one, this study was made by the Chinese Academy of Medical Science and Peking Union Medical College. That was published in Frontier in Microbiology in 2016. Right? Found that prophylactic use, right? Prophylactic means preventive use of Ganoderma extract may inhibit tuberculosis replication in a mouse model of spontaneous latent tuberculosis infection. Okay, so the study found that Liang can inhibit bacteria from causing latent TB. Okay, this study was made in two parts. One was to find out a new way to detect latent tuberculosis. The other was to see whether Liang can help to prevent and treat latent TB. Okay. Now, okay, I want to see whether, right. Okay, the study want to find out first. They want to develop a latent TB model. Most of the model before this, when they want to study whether a drug is effective against TB, was they will usually inject TB bacteria. Then after that, they inject anti-TB drugs. And then as it's falling, and during that period when it's falling, when it's healing, then they say, that is the latent TB period. Okay, so the study of this group find that this is not a good way to develop the model to study the latent TB. Why? Because this way, in the sense that the body of the subject concerned already subject to antibacterial agent. So how can it be effective development? So therefore, they go for this new model. To go for this new model, the first cultivate this bacteria, H37RV. This strain, maybe there are a few strains, I don't know. They covered this strain for 3 weeks to mid-log phase. What is mid-log phase? To a phase where it is starting to multiply. Okay, mid-log phase means it's starting to multiply. Then after that, they inject once a week into the mice through the tail, okay, for 3 weeks. And each time they do 0.1 milliliter of the virus, okay, 100 CFU, colony forming unit, for each mice. So when they inject in, and at the end, and then of course, in this case here, they will have to, every few weeks after injecting, they will then sacrifice a mice and measure. So they first start maybe like a few hundred or a few, they divide the figure lah, huh? So every week they will kill a few. Then they will measure the lungs, the spleen, the liver on the bacterial load. This is how they check, okay? Now, the study then found that between the period 8 weeks to 20 weeks post-infection, post-inoculation, I want to say, is an ideal latent TB infection evaluation period. Okay, LBTI is a latent TB infection evaluation period. So that window period where they, after they inject 8 weeks to 10 weeks, 20 weeks, is a window period where it can be a latent TB. It's equivalent to a latent TB infection. Okay, that is a similar model to the human being. So they, like I said just now, this model need not have any anti-tuberculosis medication intervention. So it become a very clear model. So they find that this is a successful model. So once that, okay, this here, the next one, I show the chart here. Now you look at the chart here, the post-infection of the lungs and the on the left, the lungs and the spleen. You find that after the injection, right, week 3 onward to week 20, you see the bacterial load was 1.5 and below. Okay, that is equivalent to what human being latent infection TB like. The bacterial load in the lung was low. Okay, only after week 20 that the bacterial load shoot up, maybe it become active lah. Now then the right picture, the right chart tells you that, you see, there is nothing in the propolis infection week 3, right? Week 3 there is no picture. Week 5 there is no infection, no bacterial load traded obvious, and week 8 also not obvious. Only week 16 onward, the bacterial load start to be more obvious in the lung. Okay, this is therefore they consider that this period the bacterial load in the lung is low enough to be considered latent TB infection period. Okay, next one. All right, so of course now that they found that this model is ideal, the next model that they do is to prevent. They work on the prevention now. The prevention, they use Liang spore and oil, mix it with the food, right, and feed it to the mice. Okay, they create 3 groups. Okay, one group control. They are infected. They are fed with normal food. 2, the therapy group. They are infected, fed with a mix of Liang and Liang spore and oil from the day of infection, from the day of inoculation to week 16. okay, from the day of inoculation, the day that they inject the bacteria into the body. Okay, then the preventive group, the prophylactic group, is that 1 month before they inject the bacteria into the mice, they start feeding them with links. Okay, until week 16. Right. Then at the end of it, they found that bacterial replication, like I told you, right? Bacteria is about replication, right? So if you can control the bacteria and not let them multiply, that means it's a success. So bacterial replication in the lung and spleen were inhibited in the prophylactic group during the first 8 weeks post-inoculation. Okay. Okay. Next one here. Let's continue. As there are no obvious difference in the inhibition between the control and the therapy group during this period, this 8 weeks, the study concluded that early use of links extract can exert anti-tuberculosis activity. So you can see for the first 8 weeks, they can stop the bacteria from multiplying. Okay. Now, of course, they look at the immune cells. Right. They want to find out further. Okay. They look at the immune cells. Okay. I mean, I'm not able to show you the other part of the reports because the reports didn't have a free access. So based on the magazine don't show me anything. Okay, but if you want to read further, maybe you can try to access yourself to read on it. Now then they want to know exactly what happened. How come it can do like that? So they analyze the immune cells in the body of these mice. And they found that the dendritic cells, the antigen presenting cells, that is the innate immune system, part of the innate immune system of this preventive group, when you compare to the control, they were higher in the blood before infection. But once infected, they were higher in the lung. Okay, so that's why we've been telling you all this while about links. Links can help to increase the activity of your immune cells. This is the case, right? Before that, you were just circulating in the blood, looking for bacteria to fight. The moment the bacteria appear, straight away they're going to attack and tackle the infection. That's why they move into the lungs. Okay, so the researcher therefore suggested that probably this is how links help to inhibit the growth of this TB bacteria. That is by activating the immune cells. Get it ready, put it on its toe. Okay, right. Next report is about lung fibrosis. Okay, that as it is links polysaccharide can protect lung fibrosis. Polysaccharide is one of the main components of links. The other component is triterpenoids or ganoderic acids. A group of ganoderic acids is triterpenoid. Okay, right. Look at okay, we delve a little bit more on pulmonary fibrosis, lung fibrosis. Right. Just now we did mention about it. So as it is, when you have fibrosis, that means the lung is scarred, it's damaged. So when we say the lung is damaged, that means it's scarred. Just like a liver, you have liver fibrosis, also scarred. Right? How it arises? It arises not because you get a injection or you get a cut, like it's actually a natural healing mechanism of the immune system, right? When you have a wound that arises from, just now like I said, infection, chemotherapy drug, all those factors that I mentioned earlier, right? You have a wound that causes it. Then you have inflammation. Inflammation process of the natural immune system. And then when it heals, it becomes a scar. Okay? Some people are more susceptible to it, some people are less. Just like just now I mentioned about keloid, some people tend to have keloid, where some people do not. Why? I also can't explain. But according to some doctors, they say darker skinned people develop keloid more than the lighter skinned people. Oh, that's the theory lah, huh? Okay, unfortunately, lungs are not like our skin, right? Yeah, you have a keloid on the skin. Okay, like just an awful sign, but it doesn't cause any harm. Although sometimes it may be a bit itchy. But if it is inside your lung, it's different. It involves gas exchange, right? The exchange of the oxygen to extraction by our body and expelling of carbon dioxide from the those it has been used up in the body. Okay. Now, in the early stages of pulmonary fibrosis, there's no symptom. You are normal. You can still go about to do it. But when you become advanced stage, walk 2 steps, 3 steps, you also have problem. You have breathing difficulty. You loss of weight. Just like people with who smokes opium, people with COPD. You see, they cannot move. They move a little bit only, they are breathless. Okay, and because of the fact that they cannot breathe so well, they cannot eat. And when they cannot eat, they lose appetite. They lose appetite, they lose weight. Okay? Yeah, next one. All right, the study by the Nanjing Medical Unit, Nanjing, an affiliated university of the Nanjing Medical University, on the protective role, showed that Lingzi polysaccharide can help to protect the lung from fibrosis. Okay, this study was that they induce it with chemotherapeutic drug biomycin. Okay, this biomycin is used to treat cancer. I think prostate cancer lah, other cancer lah. Okay, so it tends to cause pulmonary fibrosis, as it has been shown, because they cause inflammation. Right. So the next one. Okay, the study, of course, extract Lingzi from the fruit bodies, like what our Lingzi is. Our Lingzi also extract from fruit bodies. Right? They extract the polysaccharide. Right? Then they create 5 groups of mice. 1 normal mice, untreated healthy one. Okay, 2 mice treated with this chemo drug. Okay, the purpose is, of course, to induce pulmonary fibrosis. And group 3, same thing, treated with this chemo drug and steroid. Steroid is one that help to reduce inflammation. Okay. Then you have group 4. Group 4, mice treated with chemo drug, but this time around fed with polysaccharide, 100 milligram per kilo. And group 5 is the same, it's just that there's more fed with more Liang polysaccharide, 300 milligram per kilo. And they do the study for 28 days. After 28 days, the mice are sacrificed to study the details of the lungs. Okay. The study measure the effects. How they measure the effects of pulmonary fibrosis? First, they have to know whether there is any damage to the lung. So they measure by index called pulmonary index. That index is calculated by the weight of the lung divided by the weight of the body. Remember, I was just telling you, when lung get damaged, they will enlarge. The lung get damaged, you enlarge. You see, people with TB, their chest is bigger than usual. No? Why? Because you need more air. So naturally, your body tend to be bigger, And at the same time, you lose appetite. So you lose weight. So if the lung weight become heavier and the body weight become lighter, the index become bigger. And when the index become bigger, that means it is showing that there is fibrosis, there's lung damages. All right. Now you look at the chart below here, you see the body weight and the lung weight, and then after that, the index. You look at group 2. Group 2 is the one that is treated with chemo drug only, right? It goes to 1.1. Okay, that means very serious damages, whereas the healthy one is only less than half. Okay, and group 3, yeah, of course, you use steroid to treat it. It helps. Right, reduce it to 0.6. But who knows? Yeah, as you know, steroid has a lot of side effects. But if you look at group 5, with a high dosage of polysaccharide, it goes even lower than the steroid group and very close to the normal. So this goes to show that Liang polysaccharide can help to reduce pulmonary fibrosis, okay, basing on this index, right? Okay, next slides here. Here, I know, okay, if you look at from the picture here is the correct way. I mean, if you later on you access through your iPhone or iPad, Safari, I think there's a slight change in the direction. Okay, they analyze the lung tissues of the mice through histology, and they found out that the inflammatory cells infiltration, okay, when there's inflammation, the inflammatory cells infiltrate into the lung, okay, is highest in group 2. Group 2 is the one that you see on the right, top right, right? A lot of purple color. Show that there's a lot of inflammation. And you look at the one at the bottom left, the group 5. It shows that it's very close to the one on the top left, the normal healthy mice, right? So this also shows signs that that the inflammatory cells in the lung is much lesser for the Lindsay group with a higher dosage, right? Okay, next one. Okay, the other thing is another measurement of the pulmonary fibrosis is to measure the collagen. Collagen inside the lung. I mean, we all think that collagen is the one that is between your joint, but of course, it's not only the joint. Okay, collagen also can happen in the lung, inside the lung tissue. How it come about? It comes about when there's a healing process of the inflammation. The same thing, I like to use example of a keloid, you know, extra meat roll. So collagen is like something of flesh that's growing on. So when we talk about the soft tissue here growing in our knee, collagen to help us prevent knee joint pain. But collagen can also develop in the lung. So when there's collagen developed in the lung, then it blocks all this alveoli from having a free gas exchange, right? So the histology picture shown on the right shows that the collagen accumulated is, as usual, highest in the chemo group, whereas the one that is with a high dosage of Lindsay is quite close to the normal healthy group on the bottom left. Okay, then you can see here the one with steroid. It's a slightly different picture. There's still quite a bit of a collagen deposit there. Okay, so there's still a problem. The chemo group, the steroid group is the one at the center of the left you can see it's slightly different. All right, so this indicates that, as usual, lesser fibrosis for high dosage of Lindsay polysaccharide. Okay, and of course, then the study also want to know what happened, how they go about. They analyze the antioxidant enzyme in the lung tissue. So what are the antioxidant enzyme that they want to study? They look at the superoxide dismutase, in short SOD. This is an important antioxidant in the body that converts superoxide into hydrogen oxide. Okay, superoxide is something bad for the body. Catalase converts this hydrogen into water and oxygen, harmless oxygen, so that we can breathe out or we can pass out, right? And the GSH prevents cell damages. They measure all this. They also measure the GPX and MDA, marker of oxidative stress. Okay, all these antioxidant enzymes are our self-regulating defense in the body. Okay, they help to keep the free radicals in the body in check. So if the balance is off, it can cause oxidative stress, right? So like if the free radicals is more than the antioxidant enzyme available, there's oxidative stress. And when there's oxidative stress, cell will damage. And when cell damage, all illness and all diseases will start to appear. Okay, right. So look at the anti-enzyme, oxidant enzyme. They found out that the antioxidant enzyme of the Lingzi polysaccharide group has increased, okay, compared to the other group. Okay, so therefore the study concluded that probably it is this antioxidant ability of Lingzi that reduces the inflammatory response, and as a result can protect the lungs from fibrosis. Oh, so all the figure here I don't want to go through all the figure, but this figure tells you that. So you just look at SOD, the third column. Okay, you see that of course a normal healthy group is 71. All right. If you have chemo, the SOD drop to 30. Round figure lah. If you have this steroid, it come back to 60, improve a bit, the SOD improve. But if you low polysaccharide, it's 37 like that. But high consumption of polysaccharide, it brings it up to about 55. So it has shown an improvement in antioxidant level in with Lingzi. Okay. So in conclusion, the three reports show us that Lingzi inhibits bacterial replication, and this inhibition of bacterial replication stops the bacteria from multiplying in our body. And when it stops the bacteria from multiplying in our body, hopefully our body immune system will pick up and protect us. And the next thing is also, Lingzi can also activate the immune cells in our body to fight against the bacteria. So that's why first and second point more or less is connected, right? It activates the second level of the immune cells to tackle any bacteria that broke through the first layer. Then you have the antioxidation, removing of free radicals, protecting our cells from damages, right? And protecting the lung from damages. Especially now with COVID-19, if you get infected, yeah, although the death rate is only 3%, but it may cause damages to your lung, right? Now you may not feel it, right? Like I say in the research, early stages, you don't feel it, but advanced stages, it become very bad, all right? So therefore, Lingzi as a supplemental treatment to lung over these centuries are now proven scientifically. Okay, with that, I end my sharing. Thank you very much. Right.